Many of you know that from time to time I invite a special guest here so that you might hear about them and hear about their work and convey something of their good story to other people. So today I'm introducing to you Professor Mark Cook. He is the Chair of Medicine at Melbourne University and at St Vincent's Hospital, and also the Director of Neurology. He'll tell us what neurology is in a moment. I'll give him prior notice of that question. But he has a very distinguished record behind him in this field of the human brain, in the field of medicine generally. His reputation stretches from Melbourne to America, to London, many places overseas, and in that regard, in particular, he's been working on the matter of the brain and the disorders of the brain, thereby helping many people. And in particular today, we're hearing about one disorder, namely the disorder of epilepsy. So we're going to hear about it, and I'm going to invite him to come and join me right now. Mark Cook, would you please come forward? Would you welcome him? I'm very pleased to say that this is not your first time in these precincts.
That's right. I was guest here in October for the breakfast talk.
And have we got good sound here?
No? Is that better? Yeah,
yes.
Okay.
Mark was here for St Michael's Day, a very particular day when I wasn't here. So he stood in for me very well. Some of you know that I fell suddenly under the hands of a spinal surgeon, and I was telling him earlier on today I'd commend him to the spinal surgeon as well.
We've swapped conditions.
Yes, I'm all right now. He has a bit of a painful back. I wanted to, first of all, not only do I welcome you most warmly here today whilst I'm here, but we wanted to say, well, what is neurology really?
All right, so neurology is the study of the brain and conditions that affect the brain, spinal cord and nerves. So nerves in the limbs, for instance. So it covers a very wide range from epilepsy through to stroke, through to foot drop, bad backs even, to avoid any physician heal thyself jokes. So it covers a very broad spectrum of conditions, and some neurologists are mainly interested in disorders of the peripheral nerves such as carpal tunnel syndrome and slip discs, and others like myself are more concerned with conditions like epilepsy. And my main business is dealing with people whose epilepsy is uncontrolled by medication, and to some of them offering surgery where we can.
So that's a fairly wide brush, isn't it really?
It's a very broad brush.
Very broad brush, indeed. And how many, to ask a silly question I suppose, how many people, percentage-wise, suffer from epilepsy?
Well, remarkably, it's the commonest serious neurological disease after stroke, and yet that will be almost unknown to everyone. In days gone by, before the availability of drugs such as Dilantin, which really dramatically changed people's experience of epilepsy in the 1930s, it was commonplace for people to see those stricken suffer in the street. In our grandparents' time, it was a very frequent event, but now almost unknown because major seizures are generally well controlled enough that people don't experience them day to day in the way they did in Christ's time, where it was obviously, as we heard from the gospel earlier, a very prominent feature of daily life.
So prominent, in fact, apparently, that it even rates a very major mention in the New Testament.
Indeed.
Yeah. What about the issue of children with epilepsy? Do you see many children?
Not nowadays, because the hospital I work at doesn't deal with children anymore, but it used to, and so I have patients who I've seen since childhood, but I don't see too many children myself nowadays. Childhood is, though, the peak age onset of epilepsy. There's another peak in later life, but it's common throughout life, and this is another widespread misunderstanding. It's a condition which can affect people at any stage of life and does. So peaks in early life, in childhood, and in later life.
Do you mean by that in fact you can be free of it until old age and then you can have an onset of it?
You can have the onset at any age.
Any age. I was wondering about that. I have a particular interest in older age psychology here, and several of them are affected by it and controlled, but it is common in old age, late old age?
It is very common in late old age.
Uh-huh. So what about when it gets mixed up with dementia as well?
That's right. So epilepsy is a symptom rather than a condition of its own, and so anything that injures the surface of the brain in any way can cause seizures, so that, for instance, strokes, tumours, dementia, all can result in seizures.
As indeed injury to the brain.
As an injury to the brain. So anything that upsets the delicate circuitry of the surface of the brain can cause seizures because it's simply an electrical fault.
This year, Scientific American has called it the new century of the brain. And then this other magazine, I think it's called, don't worry about that, it's called The New Scientist. It too gives a whole section on it, but I thought you'd probably like to comment on the fact that there's one part here which says the Brain Institute in America has been the recipient of $100 million in 2014. I'd like a grant like that, wouldn't you?
Yes, that's a very nice grant. So there's been enormous investment by President Obama in this brain project, which obviously could have a very dramatic impact over the next few years in terms of the work being done and how much we understand the brain now. But through a lot of activity, and a lot of activity which wasn't immediately apparently relevant to understanding the brain, we've learnt a great deal more even in recent times, and I'll mention a little bit of that later.
So we won't go there, of course, but in terms of the experience of epilepsy that people have, this magazine here, for example, talks about fits of rapture that people in their epileptic seizure or experience find that experience an enhancing experience. Would you say that?
I would say that's not generally the case, but certainly for exceptional individuals, and Dostoevsky, the Russian author, was probably the most famous person in terms of experiencing ecstatic features of his seizures, and others, various religious seers, and some ethnic groups have selected those with epilepsy to be their leaders for this reason. So, but I'd say that's a very unusual feature.
Yes, I think I mentioned some of those people in the order of service to say that I don't know whether it was out of their epilepsy, but along with their epilepsy, they became quite creative individuals.
Absolutely right. So I've recently had a PhD student, Jim Chambliss, do his thesis on how he became an excellent artist after developing epilepsy in a car accident. So it's quite a remarkable event, and that phenomenon has been noted by others. So several famous artists have suffered from epilepsy, and Van Gogh's always brought up as a prominent one, but many others, and have attributed some aspects of their creativity to the epileptic process.
In your own particular work, I know that you have done some groundbreaking, world-breaking research. Could you just give us a little snippet of that? What are you doing at this moment, which is really so very important?
So an area of work we've been particularly interested in is whether epileptic seizures can be predicted. And a lot of the burden of the illness comes through its unpredictability. Obviously, it's terrible to be struck down by an illness which might cause you to fall and convulse, but most people's seizures don't involve that. Most seizures involve seconds or maybe a few minutes of losing contact with the environment. People might stare and swallow or behave strangely, after which they're a little confused. But during these times, they're at risks. Obviously, driving, their occupation might present a risk. We heard again in the Gospel, fire and water. These were very common injuries in not so much now in our society, but in less developed societies, falls into fire and drownings through epilepsy are very common events, even through these brief lapses in consciousness. So being able to predict them would be incredibly useful, because people then would be able to manage their safety, their day-to-day life much better, and possibly even take a treatment at that time, or maybe we could cause a treatment to be given at that time automatically. So being able to predict seizures is very important, and recently we were able to undertake a large trial in Melbourne where for the first time we implanted devices inside people's heads to predict seizures, and this proved that it could be done. For a lot of technical and commercial reasons, it's not moved much further since then, but it is moving, and we've received some reasonably large grants recently to help us further develop this work, so we can expect to see more. I guess most excitingly, it's revealed to us some of the deep structure to the patterns of the brain and given us other insights into how the system works.
I was intrigued with in these popular scientific journals how they could get photographs of what is taking place within the brain structure, and that's going to be rather important in future, I think, don't you?
It certainly is.
What about the whole matter of you were connected with the bionic ear, is it? Or,
that's right.
And I was intrigued by that. What has the bionic ear got to do with epilepsy?
Well, the Bionic Ear Institute, or now renamed the Bionics Institute, is interested in joining materials to brain, or materials to nerves. And the first manifestation of this was joining a hearing device to the nerve that receives sound in people who are deaf to try and improve their ability to hear. And this was spectacularly successful through the work of Graham Clark. But similar sorts of systems, much as with the prediction device, are relevant, so they're ways of connecting the brain to machines.
So that really is quite an extraordinary thing taking place here in Melbourne?
Taking place just up the road.
Just up the road. So that's an amazing thing that so many people could benefit from this. I think too that I wanted to say that many people get very frightened if they see a person having an epileptic fit, which I think is understandable, that we don't know what to do. We feel ourselves very helpless and as I say, frightened. So it's very important if we can find the prevention of that situation. But if we do run into that situation, what's your advice?
The main thing to remember is that after seizures, be they big or small, people are often briefly confused and might appear to be behaving irrationally. And they need just to be understood, not restrained, and attempts must be made to keep them safe, obviously, but best not to interfere. If people are unconscious, they should be placed on their side and allowed just to recover themselves. The main thing is that people are sometimes a little confused and even a little combative in that phase immediately after a seizure, and often people mistakenly try and restrain them, but that's not necessary. The seizures themselves generally don't harm people. Major convulsions, where you might get very short of oxygen if they go on for a long time, are harmful, but the seizures are only otherwise dangerous depending on the circumstances of the environment and the individual's activities. So most times you don't need to take any special action other than to recognise it and give them a bit of understanding as they're coming to.
That's well worth knowing. I noticed that in some of the papers written that death does, however, occur, and Robin and Bernie's son was one such case. And then I discovered that quite a number of deaths occur in Australia each year by virtue of, not by virtue, but as a consequence of or as part of the epileptic experience.
That's true. That's still quite a mystery. We don't know how sudden and unexpected death in epilepsy, or so-called SUDEP, occurs. It's not absolutely clear that it's directly related to the occurrence of a seizure, but the death rate in epilepsy is certainly higher than you'd expect, and it's an important cause of death in young people with epilepsy. Now, you might compare it to asthma. If you have asthma, of course, death is a risk of asthma too, but the mechanism there is a lot more obvious. Whether it's a problem with the brain or the heart isn't clear in epilepsy, but certainly about 300 people in Australia die every year from epilepsy, and I think it's an unfortunate thing that we don't appreciate the magnitude of this problem, and that we still regard this as a rare, unpleasant condition that doesn't really deserve the attention that it should.
And that's a good point where we might stop, because it really does highlight the very important reason why you're here today. So I'd like to thank you for coming very much indeed, I'd like to thank you for being here on St Michael's Day last year, and we're going to hear more from you in a few moments. Would you, at this moment, please thank him. Thank you.